Hey guys, Dr. Ben here, Functional Medicine Centers. So excited to talk today. Going to get into something really interesting because a lot of people have been seeing the news, and I don't even like calling it news anymore because they don't really report news. They report their agendas, all of our mainstream media. But what we're looking at is there is a spike in the number of positive tests in the United States. So what is actually going on? This is actually happening in Europe and some other places. I'll post some screenshots, some reports, some different things down below as well. So what is happening? Are we actually seeing improvement and actually this isn't as bad as what they're saying, or isn't as bad as what they're saying? What's really going on? So really interesting information coming out the last couple weeks. Here in Colorado, where my practice is and where we live, there is a spike in the number of cases, and pretty dramatic when you look at the number of positive tests. And that's the first thing that we have to figure out is, does a positive test mean a case? Does a positive test mean that person's actually sick? We've talked about that many times on here, that upwards of 90% of PCR tests is not truly an infection. It's not truly a contagious person. And that was based on a lot of different reports, especially the ones in the New York Times. So what is happening? Well, we're seeing a lot more cases, and like President Trump says, yes, there's more testing being done, so more testing being done, we're going to have more cases, but then there's also that potential that more people are actually getting infected. And so where are we? Somewhere in between there. Hey Hilda, good to see you. Anybody watching, go ahead and pop down below where you're watching in from. Love to give you a shout out and see where you guys are watching from. Okay, so here's what's happening in Colorado. Right now, we have about 3 times the number of positive tests that we had way back in March and April when COVID was truly going through the state, when a bigger percentage of people were infected, and it actually had an impact on the hospitals and all those things. But right now, we're less than a third the number of deaths per day that we were having back then. So even though we're 3 times as high, hey Randy, good to see you out there in Scotts Bluff. So even though we're 3 times as high, we're a third, Tanda, good to see you, we're a third the number of deaths. And so multiple reasons why. Shelly, good to see you. Be safe out there working in the hospital world. So here's what we're looking at. The people that are getting infected, the rates and the research are showing that the people getting infected, the fatality rate is going down dramatically. In the United Kingdom, in England, hey Cynthia, hey Stephanie, good to see you guys. In the United Kingdom, it was going from 3% of the people that were getting infected were dying. Now it's down to 0.25 to 0.75. Hey Kayla, be safe out there in Nevada. Sherry, good to see you in Ogallala. So what's happening is the fatality rate, the number of people that are getting infected, a lot less of them are dying. And there's multiple reasons why, and there's a lot of reports, a couple that have just come out recently, showing that multiple things. One, a lot younger people are actually getting infected, and so the average when it was really hitting March kind of through July, August, there it was in the mid 50s was the average age of the person getting infected. George, good to see you there. So what happens now is that it's down into the 30s is the average age of people coming up with a positive test or potentially even an infection. So what does that mean? Well, we know the older somebody is, the more likely they are to have some issues with COVID and potentially have severe issues and potentially die. So what does that mean? Well, it's actually good that younger people are getting COVID now, and if we are going to have a spike, we want it to be younger people, because statistically under 40, they have a very, very, very small chance of dying from COVID, and even a higher chance of dying from flu is what the research has shown. People under 20, they have statistically 0 chance of dying from COVID. It's going to be potentially some other things. If they have cancer or something like that, it might contribute to that. So one of the big things and one of the big reasons why you'll see in the news, hey Tamara, good to see you up there in Cheyenne. One of the things that you'll see is that there's this spike, and we're seeing 60, 70, 50,000 people a day coming back positive on the test, but the death rate and the fatality rate is actually staying pretty darn low, even though they're saying, oh, hospitals are filling up and all these things. But that's okay too, because here's the other thing that's happening is as the medical system has gotten the hang of what to do with patients, just like President Trump, he was out in 2 or 3 days. They gave him the cocktails of the things that he needed, had him on some oxygen, done a few things, and he was back out. And he's what, 74? And I guarantee you he's insulin resistant based off his diet. He's got high blood pressure. He's a little bit overweight. He's not that category of 74-year-old that you're like, hey, go get COVID and I think you'll be fine. And yet, he bounced back very quickly. And that's what we're seeing with a lot more people. The first round that went through, when you look at New York, New Jersey, Michigan, all these states, they lost a high percentage of their people were in retirement homes. In Europe, up till now, it's like 46% of the people that have died are actually from retirement homes or assisted living homes. So, a huge percentage of those people that if they were going to die, they probably caught it and died through there. And now it's going through the rest of the population. For the vast majority of people, yes, there are some people that, we've talked about that cytokine storm, that inflammatory process, and there are some people that will have it worse than some other people. But ultimately, for the vast majority of people, 99.9% of the people, it's going to feel like a mild flu. I've had many people I know that it has gone through, and they've said, yeah, I had 3 or 4 days, I was tired, a little bit, maybe the smell and taste went away for a few days, some different things. But most people, it's not going to progress from there. And why is that? Well, one of the big reasons now, it's hitting younger people whose immune system, even if they're not in perfect health, hey Chris, good to see you, Tecumseh, Missouri, long time no see. So for a lot of people that even if they're under 40, under 50, and they're not in the best health, their immune system still can function better than an 80-year-old that is compromised, that has inflammation, all these different things. So what we're looking at is that the younger people getting this, that's actually a good thing, and their bodies are going to be able to fight it off better and be able to handle a lot of these things. So what do? Well, the medical model that is treating people in the hospital is doing a much better job. They're not ventilating people. That was killing people left and right. That was actually one of the worst things they could have done. They're not doing that anymore. The medical model is now giving some inhaled steroids. Potentially they're doing hydroxychloroquine. They're doing high-dose vitamin D, a lot of different things. The remdesivir, that one is, there was just a study came out showed that it is not effective at all. It's $3,000. Hey Brian, good to see you out there in Omaha. Come back safe. So it's not going to be that very effective. It may decrease the number of days in the hospital, but that's it. It's not changing that overall outcome of the disease state. So for one thing, it's affecting a lot younger people. For another thing, it's the treatments are way more effective. They know what to do. They've seen multiple people like this now. They know how to treat it way better. And that was the whole point of the shutdown of flattening this curve. Give the medical model a chance to do it. So when people are freaking out, oh, the hospitals are filling up, all these things. Then we're like, okay, well, that's actually not a bad thing, because there's a very good chance that those people are going to come out of the hospital and that they're going to be okay, because the medical model has a lot better idea of what to do and how to treat these people that are coming down with this. So that being said, if you are immunocompromised, if you are worried about COVID, by all means wear a mask. There is some research that shows that you'll have less likelihood of getting viruses into your body. You'll still get some will still go in, but there's even some research now showing that it's the volume of the amount of viral load that comes into your body can make a difference on how your body reacts to it. So if you are immunocompromised, if you're sick, if you're worried about this and you want to wear a mask, by all means wear a mask, and it can block some of that viral load in there. What the research isn't showing that great is that by wearing a mask, and if you're asymptomatic, that you're going to spread it to all these people. the research isn't showing that, but it does show that if you are concerned and you want to prevent excess viral intake into the body, it's not going to totally prevent it because the viruses are small enough to go through that mask, but it's going to slow it down. And there is some research that shows that if you're not exposed, and that's why they say if you sit and it's this long exposure, if you're sitting next to somebody that's sick or you're living with somebody that's sick, you've got a lot higher chance of coming down with COVID. But what happens then, if it's just a short encounter, maybe hit it a little bit, the immune system's going to be able to deal with it, and you can move on from there. So again, multiple things that you have to think about here. You have to think about, one, keeping safe, washing your hands, don't sneeze in your hands and touch people, all those things. That's just common sense that people should, well, before this, I don't know if people were always washing their hands and doing what they needed to do. My 16-year-old was appalled at how many guys don't wash their hands after going to the bathroom. But that's a whole nother story, and yet we've got to make sure that we're not spreading any germs, whether that's flu or cold or anything like that, because that's just polite. You don't want to shed germs onto other people. But then also you've got to make sure your immune system is as strong as feasibly possible. If you're not up in the 50 and 60 range on vitamin D, you've got to get that up. If you're not taking zinc, or at least have zinc on hand for if you do come down with something, you've got to get zinc. If you truly have some lung issues and are truly worried, you need to have a nebulizer on hand and be able to nebulize hydrogen peroxide, nebulize glutathione, and as soon as your body, you recognize that there is an infection going on, because if you are in that compromised category and you're worried about this, you've got to prevent it from getting into that cytokine storm. We've been talking about inflammation a lot this week. Cytokine storm is where that inflammation is going to drive it, and that's when people are going to see the problems. They're going to have fluid in their lungs, they're going to go into this exaggerated inflammatory process, and that's when you're going to get some major issues coming down the path. So great news. Yes, we are seeing higher positive tests. That doesn't necessarily mean a positive case or a positive infection or they're contagious, but what it does mean is that there's more positive tests, okay? But we're seeing the fatality rate down dramatically, and multiple reasons. Some are going to be because of the age of people that are being infected and coming down with that, and the other is going to be because of the experience that the medical model has in treating and taking care of people. So yes, there is a spike in cases that we're seeing at this point, which makes sense. There's going to be more cold and flu, and we know that 90% of the people that come back positive on a PCR test for COVID, it's not truly an infection. They're not truly contagious. So the more people that are feeling sick, the more people are going to test, and the more cases they're going to find, even though it may not be a true COVID infection. So that's one part of it, is just that there's more infections going on. But the other great part is that a lot younger people are coming down with infections, and even if they do get sick or they do need to go to the hospital, way more likely to handle it better. But what you can do right now is get that vitamin D up. You can get good quality sleep. You can take your melatonin. We talked about that. The oregano is great for that antibacterial. A lot of the things we've been talking about. Shoot us any messages, any questions you guys have. But there is positive coming out here. The mainstream media do not want you to hear those things. They want to keep us in fear. Unfortunately, that drives up ratings. But there's a lot of constructive things going on. Yes, you've got to keep your body safe. You got to keep your family safe. But strong is always better than safe. So keep up the good work, everybody. Shoot me any messages, any questions you have, and make it a great day.